One of the things that our group is most proud of is that the SECURE-IBD registry has served as a blueprint for a number of other conditions, both in the space of GI as well as in the space of other immune-mediated conditions. And very early on, we really worked hard to allow other groups to have a expedited startup so that they could collect similar data to us and answer some similar pressing questions in other patient populations. And so we've worked with a team that is studying cirrhosis and liver transplant, a team that is studying celiac disease, several teams that are studying psoriasis and rheumatologic conditions, including juvenile idiopathic arthritis, rheumatoid arthritis, and lupus. And more recently, we've worked with some hematologic organizations studying sickle cell disease and bone cancers like leukemia, lymphoma, and multiple myeloma. And we really look forward to collaborating with a lot of the groups like in dermatology and rheumatology that use a lot of the same medicines that we use to treat inflammatory bowel disease, so that we can pool data together and learn even faster as a collaborative effort. And so I know that many of you on the call are patients or caregivers, and we've received a lot of questions from the patient community. What can we do to help? So first and foremost, if you think you have signs or symptoms of coronavirus, please call your IBD provider. Call them not only to ask for advice as to what to do in the midst of this illness, but please encourage your provider to report cases of coronavirus to the SECURE-IBD registry. Again, that website is www.covidibd.org. And if you are a patient yourself, you can participate in the IBD Partners network. The IBD Partners network has been established by the Crohn's and Colitis Foundation in the United States, but is a worldwide direct-to-patient registry. The website for that is www.ibdpartners.org, and patients can complete surveys about inflammatory bowel disease, provide patient-reported outcomes, and other really important data that only patients can provide about the impact of IBD on health and life. And over the next week or so, we will be launching a special module on coronavirus, where patients will enter a sub-study and receive surveys every 2 weeks about the symptoms of coronavirus, as well as about how the entire world has changed over the last month. Medicine has changed, the practice of telehealth has changed, the physical distancing that Gil had mentioned has really changed life for so many of us. And this patient experience survey will help to capture the unique aspect of these changes on the lives of patients with inflammatory bowel disease. And on my last slide, I really would like to acknowledge all of our partners who have been so instrumental in making this project work, including the Crohn's and Colitis Canada, but also several other organizations, both in North America as well as internationally. And we particularly like to thank the funders of this project, including the Helmsley Charitable Trust, our clinical science network at the University of North Carolina in Chapel Hill, and a number of pharmaceutical partners who are listed on our project website.